Good morning and welcome to Crack the Mic podcast with Agent of Change, Corey Davis. And this week's segment is entitled Diversity in the Foster Family Part 2. The foster care system here in the United States is often referred to as being flawed by many experts in the area of human services. And suffice it to say, when we compile the lack of diversity that we see with respect to the families or caretakers that provide those services for the agency, it makes it a double entendre. Because, as we know, the data itself demonstrates that the lack of importance for cultural competence in the foster care system can lead to foster kids having a lack of strong and cultural identities that we know is linked to things like greater self-esteem and can reduce levels of depression. Now, to help me further this discussion, I have a very astute panel that includes former City of Miami Commissioner, Mr. Jeffrey Watson, Dr. David Bullock, a professor, a social commentator who contributes to syndicated press like USA Today, Russia Today, just to name a few. Also, back to the podcast, we have mental health therapist Ashley Samuels, and also, last but certainly not least, Mrs. Sherman Guerriere, child welfare trainer and diversity trainer coordinator for Citrus Health Network, one of South Florida's largest mental health and behavior providers. Good morning.
Good morning.
Good morning. Good morning.
So let me ask you this question, Dr. Bullock, if I may. Why is it important that children of color in the foster care system need to see more foster parents that look like them? Honestly.
Well, good morning, Brother Decory and panelists. And again, great question. Remember, we were talking last time in the other segment about the right intention, but the need for institution building and infrastructure. Part of that infrastructure and institution building has to deal with cultural competency.
Right.
And so it's very, very important for children of color to have access to more foster parents of color because culture is so very important.
Absolutely.
And so when children are when their lives are interrupted, can you imagine having your life interrupted and say leaving your mother to be placed with a family that only eats tofu and speaks Vietnamese? It would be very, very difficult for you to do well.
Right.
It would have negative effect on your well-being. You might be safe, but you might not do well. And then that might not end up being a permanent placement. And so when we think about the goals of well-being and permanency, in addition to safety,
right,
cultural connection and competence is very important.
All right. So you want to go ahead and share your thoughts on that question, Mr. Watson?
I mean, look, there's going to be a lot of things at play when you're talking about the foster care system. And it's going to be disproportionate. It's going to be disproportionate because we're affected by our environmental conditions disproportionately.
Right.
And so our kids are going to now take it on the chin because there's not going to be enough people to take on all of the African-American kids and the brown kids that are now entering that system.
Right.
And there's not going to be enough people, and which is why you get even overcrowded conditions per se, because there again, people are dealing with the times, they're dealing with their own kids And consequently, they're not as easily accepting of bringing in kid strangers into their environment. It's
Right.
just not happening that way. Look, I mean, for the there was a comment earlier when we
Mm-hmm.
spoke last week
Mm-hmm.
regarding, cultural competency and
Right.
Vietnamese family and what have you. But look at
Right.
what happens with all of these Americans going over to Asia and
Mm-hmm.
adopting kids.
Right.
Look, I'd rather have someone love me that even doesn't look like me, but at least I'm able to learn about myself
Right.
than now be stuck somewhere in a temporary status for year. So I'd rather have, I would rather as a kid have love from someone,
Mm-hmm.
which also helps me over my traumatic experience. And
Right.
hopefully someone educating me than to be in a temporary status
Right.
for which is what the results for some of our kids usually is, because there are a lot of people are not going to engage
Mm-hmm.
in the foster care system. So
Right. Right. I definitely can definitely understand that. You want to go ahead and share your thoughts on that question, Ms. Guerrero?
Yes, thank you. And thank you, Mr. Watson. I think we have a unique responsibility. I think we're doing great with starting this conversation. And I think we need to utilize our connections, our resources in order for us to create a meaningful change in the system of care, in the foster care system.
Right. Right.
Children of color, we know, are disproportionately represented, not just in the Florida foster care system, but in the United States foster care system.
Absolutely.
And we just
Absolutely.
need to make sure that every youth, every family, every child deserves effective support, no matter what the color of the foster parent is. Yes, it would be great, but because we have such a large amount of foster youth that are Black or brown, we don't have enough the foster parents to support that. We just need people who are loving, caring, people who understand, people who are going to treat our families as humans, people who are going to share the power, people who are engaging with them. And what we're doing uniquely here with our Addressing Child Welfare Disparity
Mm-hmm.
initiative is we're bringing the voices of the people that are most affected. We're bringing the experts, the youth, the parents, right, to let them know their concerns and really what they need. And what they need is someone to talk to them. How are you? How you doing? What do you need? What
Absolutely.
happened to you? And how can we help you? You know, when the youth are coming off from runaway, did you eat? Are you hungry? You
Right.
know, are you cold? Are you sick? So as long as we can have foster parents and caregivers who can come from that aspect, I think we would do a lot in, addressing the needs that the family have, is really just engaging them, supporting them exactly where they're needed.
Right, right. I couldn't agree with you more, but I definitely cannot overstress the importance of the need for kids to see people who look like themselves. And I think David sort of um, can echo, or have echoed this sentiment when he stated his comments. But I digress. But we're going to go ahead and
No,
go ahead.
no, I was gonna say, and that's why we're pushing more prevention. If we can rally around our families and support them, where we can even prevent them from entering the foster care system, then they can stay in their families of origin and they can stay a part of their culture, a part of their community, and we can support that. So we're doing a lot, and we're talking about prevention and rallying around our communities and going out to the
Right,
communities and partnering with our stakeholders, because if we can prevent them from coming into the foster care
right.
system, then we are sure that they're going to be within their communities, within their families, and knowing that they're around people that are part of their culture.
Right. And I digress. I do believe that both points are equally important. But we're going to go ahead and take a break for a commercial. We'll be back in just a moment.
At Immaculate Home Healthcare, we recognize the important role home plays in healthcare, which is why we are dedicated to helping you and your loved ones heal at home. Together, we work with you, your physician, and family to help make the transition from hospital or facility care to home care a smooth one. Our team of highly skilled health professionals includes nurses, therapists, aides, and medical social workers that have been chosen for their compassion and commitment to care. They undergo rigorous background checks to ensure that only the most dependable and trustworthy staff serve you. People turn to our home health care for help with services like post-surgical care, wound care, chronic disease management, diabetes, pain management, and hypertension. Home health care costs less than hospital or facility care, and Medicare pays 100% for qualified patients. At Immaculate Home Health Care, we provide quality medical care in the comfort of home. Call us today at 561-372-9108 to discuss qualifications and payment options, or visit us online at www.immaculatehhc.com. We'll be happy to help.
Okay, we want to go ahead and thank our sponsors. You want to go ahead and answer the question, Ashley?
Yes. So thank you again. So I agree with Mr. Watson and Ms. Guerriere. I think the simple answer, as well as Dr. Bullock, I think the simple answer is representation matters, right? We want to see people that look like us, that can show up in a caring and loving way.
Right.
I think that while being able to love and care for somebody obviously is the number one characteristic that we want to see in foster parents.
Right.
But I think it goes a little bit deeper than that. I definitely think that there has to be some cultural humility there, some understanding of trauma, some emotional intelligence and things of this nature. And it goes deeper than skin color, right? If you think of South Florida, when we're talking about Black people, when we're talking about brown people, we're talking about so many different cultures.
Right.
And so those things have an impact as well.
Right.
I grew up in a household where we were encouraged to speak up. One thing that my mom said in the house all the time is, you deserve respect. And if wants respect from you, they have to give you respect as well.
Right.
That would not fare well in your average Caribbean household. And so things of those nature are important. It's not just about like having a parent that is Black or having a parent that is brown, but truly having somebody that understands your culture. And I think it takes us back to our conversation earlier when we were talking about our families in the northern part of the county were typically not taking in foster youth. One thing that really brought to mind for me was this idea that well, why aren't they taking in foster youth? And it couldn't help. And I don't know the statistics around it. I would be excited to find out more. But it brings to me, if we're all living in this in the same community, which we know there's institutionalized racism, there's state sanctioned intentional deprivation of resources. If I can, and on top of that, you have the crisis, the rent crisis that is here in Miami right now. It's extremely expensive to live in Miami right now. So if you think about all of those factors, and you might have somebody with already has a child and they want to foster, or they already have a family and they want to foster, but maybe I don't have this. Maybe I don't have a sufficient income per the state of Florida to even have additional youth in my household. I think that one thing that we have to remember, one thing that I've heard today is that, sometimes these foster parents are taking youth in because of the money. And I think that is something that I've heard for many, many years. And serving as a school social worker, what I have found is that a lot of times they're not making any money off of these kids. They don't get paid. When they do get money from the state to take care of those needs, those are a reimbursement, and it typically does not cover all of the things that they've had to put out. I think a very specific instance is at my school where we've had to help foster parents buy furniture, buy clothing, buy a lot of things. This work is really, really hard work. And I think we need to dig a little deeper, kind of what you all were saying about the reasons behind why the families are not taken in foster youth, because I think that reason is also very similar to why some kids fell into the foster system in the first place. And if we address that issue, right? The state sanctioned racism, the institutionalized racism,
Right.
The intentional restriction of resources within those communities, I think that we would find that a lot fewer of our kids are entering foster care. And so, yeah, I do think that there needs to be more resources. But at the end of the day, it does start with love. You have to lead with love, but where's your love going to take you? Is your love going to take you into learning more about that child's culture, learning more about their trauma, learning more about their school and their home environment? Where does the love take you? And I think that that's a more important question than simply placing kids in homes with people who look like them.
Hey, I
And,
definitely
and,
agree with you. You want to
and
go ahead and share? You have something to say, Mr. Watson?
yeah, well, I just, look, I think that both Ms. Samuel and Ms. Guerriere have made interesting points
Right.
because I like to see those statistics as well.
Right.
And Ms. Guerriere pointed out it was 20,000 kids in Florida. I don't know if that's South Florida or Florida, but she mentioned the number 20,000. I remember Michael Jordan having a saying. He said, everybody wants to be like Mike, and everybody talks about the 24,000 shots I made.
Right.
They never talk about the 60,000 shots that I missed.
Right.
And so I'd really like to see the statistics, because one thing I think I don't know, well is a good description, but one thing that I know we do, we're very, maybe not community oriented, but we're very family oriented, because I know a lot of people who will now know of situations in their family and they take on family members in a very preventative way. That is a preventative measure. And so, and when you listen to Ms. Samuel and say that a lot of people don't get money, well, it's an economic hardship. And so it's enough to believe that you don't have enough even for your own kids to take in someone else, winds up now putting you in a bad situation. A lot of people just don't want to do it. And so it may not even also only be culturally. It just may be an economic factor that won't allow you to do it. You may not have the space to now give, because if the system and the rules now say that you have to have, a certain space in order to take in more people, then you're precluded. And so it is definitely a quandary. And I don't know, because we never look at things that exist and look at them with a keen eye of changing them to make it better.
Right.
We just wind up just keeping it the way it is. And it sometimes always leads to cracks that now have very high profile cases that cause us now to have people to get in trouble. So
Absolutely. I couldn't agree with you more. Let's just change the tides for a moment if we can. And according to Dr. John DeGarmo and the Foster Care Reform, 15 ways to fix the foster care system in 2020, he suggested the following, and I quote, "Premature reunification often leads to a child's reentry into the foster care system or even, worst case, death." Now, let me just ask this question. And while the end goal of the foster care system is reunification, why is it so important to avoid premature reunification in your view, Mrs. Guerriere?
Thank you for that. I love that question as far as premature reunification. I want to say this. A lot of times people have a misinterpretation, misunderstanding of removals and from kids from their home. And we only remove if it's unsafe, right? We have to look and see if this is an unsafe environment. And we look at different few categories and different situations, and we have to decide if a child can go back, whether it's safe or not.
Right.
And I think a lot of times people are just looking at, okay, did mom do this or did dad do this, and looking at a checklist. But we have to understand it's really about how that parent think, feel, and act that we should be focusing on. And
Right.
if we don't make sure that we're looking at what we call the caregiver protective capacity,
Right.
what is it that this mom or dad is lacking that we can enhance, that we can support, that we're missing it? It's not about that day, that situation. We have to look at the total family dynamic, total
Right.
family condition,
Right.
and being able to help support the family in that area. So you're right. If we don't transition back from foster care or relative care to our parents and families of or origin with a sense of let's help them enhance their caregiver protective capacity. Let's help them enhance the way they think, they feel, they act about themselves, their children, and parenting overall. We're going to continue seeing this cycle. We're going to continue doing that. So we've done a great job in making sure that we're keeping kids home that are safe.
Right.
We're putting safety plans in place for kids that are unsafe. But of course, we can do a lot better with that as well.
All right. Thank you for sharing that. Thank you for sharing that. You want to go ahead and share your thoughts on that question, Ashley?
I think that Ms. Guerriere said it so eloquently. I think at the heart of it is making sure that children are not endangered.
Right.
And I think that one thing as a school social worker that well, my Marie finger, should I say, that I have come to, truly practice is this idea of like conscious care, right?
Right. Right.
And it's this idea that I can't parent, I can't care in any caregiving capacity, a teacher, a babysitter, grandparent, aunt. I cannot parent properly. I cannot provide care properly if I'm not healed myself.
Absolutely.
And so
Absolutely.
when we are sending these kids back into the home, we need to ensure, and even kids that haven't been removed from their home, what are we doing so that the parent can address their own mental health challenges, their own, and I don't want to say mental health illness because it's not always an illness, but challenges, right? Once I have been able to address those, and I can see things with a clear, level head with my whole brain, not just my right side emotional brain, then I'm able to connect with my child, and then I can co-regulate with them, and it's less likely to lead to things like physical abuse, and even some cases sexual abuse, because we know that is a diagnosis as well. So these are the things, but it all lands and ends on like we want to just protect the children. We're dealing with some of the most vulnerable people in our system, not in our system, sorry, in our society, and we want to just make sure that we are giving them the necessary tools, the necessary resources, so they can reach their full potential. It's not just about them being safe, but what is their traumatic growth like after? Where are they going to go back? Because when those children win, when they have a life filled with joy, when they are given the resources so that they can live a choice-filled life, that's not just helpful to them and their family, that's helpful to our entire society. When I was digging deep and doing the research for this particular podcast, it dawned on me to think about like, who are some people who have impacted this world or our society that were in foster care?
Wow.
The first person I thought of was myself. I was in foster care at the age of 3 and 4, right?
Wow.
And I think about the job that I hold now and how I impact other people. But then there's also Eddie Murphy, Steve Jobs, Marilyn Monroe, Ice-T, Tiffany Haddish, Coco Chanel. Like you had like
it's a long list.
Everybody's gonna go crazy for a Chanel handbag.
Right.
And to think that person came from an orphanage, like because you go to foster care does not mean it's the most terrible place on earth that you're never going to reach your full potential. But as a community, as a society, we just need to make sure that we're pouring into those people so they can reach their full potential, that they will have traumatic growth after whatever it is that they experienced.
Absolutely, Ashley. Thank you for sharing that. You want to go ahead, Mr. Watson, and share your thoughts?
Not at all.
Okay.
Not at all. The lady said it probably as best it can be said.
I guess you want to say they dropped the mic on that one. They literally cracked the mic with that one. All right, definitely. Now, as I sit here thinking about the reality of what is and what can't, for whatever reason, because in some of their situations, quite frankly, we've got to face the reality that things like addiction, abandonment, and in even some cases, death. The reality is this: some of these children will be forced to age out of the system, the foster care system, that is. Now, I want to kind of just sort of set the stage for this next question with the listener, because there's a social construct in America that was started about, I'm sorry, in West Asia, that was started about 3,000 years ago, the caste system. And unfortunately, many things are determined, for one, in those type of societies, like privilege or the lack thereof. In that hierarchical structure of power. And suffice it to say, many kids in our foster care system have been forced to be placed into explicit marginalized environments that their current situation are almost inevitable. So, having said that, I want to go ahead and ask this next question. What are some important factors that need to be considered when it comes to helping children of color who reach adulthood to age out of the foster care system? You want to go ahead and share your thoughts on that, Mrs. Guerriere?
Awesome, thank you. And that's an incredible question. Like I stated earlier, we're doing a lot of work on making sure we bring the voices of our youth and our birth parents to the table. And the youth have told us exactly what is it that they're needed. And of course, consideration for all children are the same. But for our Black children who are overrepresented in our foster care system, we understand that those that are aging out, sometimes their life outcomes are not fared well as their counterparts. The biggest thing that they need is support, right? They need support. They need help with education. They need help when it comes to financial literacy. They need help when it comes to housing, how to navigate, because we understand that when we're looking at our statistics, our youth that are aging out and they don't have that support, they don't have that permanent connection. Maybe they weren't able to go back home to their family of origin, but we should be connecting them with a coach. We should be connecting them with a neighbor, connecting them with
Definitely agree with
somebody.
that. Absolutely.
Right.
Absolutely.
Where they can go for Sunday dinner, where they can go for spring break, where can they go?
Right.
And we understand that those youth that don't have that permanent connection, they're funneled in now into the juvenile justice system or the criminal justice system.
Absolutely.
They go into homelessness, right? So we have to support them. We have to make sure education-wise that they're getting all the support, the tutoring, the mentorship that they need, the financial literacy that they need, and being connected, not just with a placement, but a permanent, stable connection that even after they turn 18 is somebody that they can call, somebody that can walk them down the aisle, somebody that can, give them advice. That's really what they need, those connections.
And you know what, Mrs. Guerriere, I definitely think, I really do think that what you just, the latter part of your response is so important, because statistics show that only 1 in 5 children in foster care attend college. And if they do, only 1 in 50 will graduate.
Wow.
That's quite astounding. Wouldn't you agree?
I agree. And just as you're saying that, thinking about my time in college,
Right.
we were taught to be adults, but we still needed support.
Right.
Right. And a lot of times, if you don't have that support, even if our youth in foster care, they know that they can get a free ride to a state school, right? A public school in the state of Florida. Most of them are not taking advantage of it. Sometimes because they don't know how they're going to get there, who's going to be there, what's the support. They need
Absolutely.
support. They need
Absolutely.
someone to say, you can do it. You got this. I'm here for you. It's okay that you messed up. We're here for you. Because what we're seeing is if they don't have that support, then we have that generation that's coming in. They were the foster youth of the past, and now they're the foster parents of the current cases.
Wow.
So we need to support them.
Powerful.
We need to
That's
support
powerful.
them as much as possible, and not because they're 18 mean that they're an adult. How many of us turn 18 and we still call our parents?
Absolutely.
We still call our caretakers. We still get advice to them. We still say, hey, I have a cough. What do I do? I'm going here. So they need as much people to rally around them and be their support as much as possible.
Absolutely. Your thoughts on that, Mr. Watson?
Yeah, I think it's important to really understand as they get older,
Right.
how do you start transferring skills to them, transferring experiences to them, because now if they've passed a certain age out, they're going to need that in order to be successful in the environment. And it's kind of ironic that you will find those that get to that point find themselves in the juvenile justice system, find themselves in the criminal system, because you need that support. And of course, now you have to try to fend for yourself, and that the system doesn't do well. And we are disproportionately represented in that group of individuals that age out.
Right.
Because,
Absolutely.
it's tough when you come into the system as a teenager or a preteen. Not many people want to now give a permanent home to a kid that's already basically close to adulthood.
Right.
And so it makes it very difficult. And we have to find better ways for the solution, for those solutions that will result in better results for the sake of now young adults.
Absolutely. I definitely agree with you on that, Mr. Watson. All right, Ashley, you have the last question. You have the last response.
Thank you. I definitely agree with Mr. Watson and Ms. Guerriere. For me, it's all about the resources. At work, they call me the resource queen. I'm all about letting people know what the resources are. And when I initially thought about this question, my first answer was free college. Like, that's huge. That's going to change the trajectory, not considering that self-efficacy piece, right? Considering that they don't have somebody pushing them along and teaching them the financial ropes. And it brings me back to making it up, finding things that are actually in your community. Thinking about extended foster care programs that service youth that are 18 to 20 to teach them how to live on your own, how to get a job. It makes me think of organizations like Suited for Success that will help you with employment, or Affirming Youth that will help you with Circles, which is a program that pairs you with a financial literacy mentor. It makes me think about organizations like Black Men Build, who will literally take people in off the street, give them free health care, have a women's circle weekly, have a men's circle every weekly, so that you can find that support system within your community. And when we're able to rally around our young adults, we can push them to know that you are powerful.
Right.
It doesn't stop
Absolutely.
here. Go off, get a degree, come back, and then improve your community, right? Be an asset to your community. And so it is about the resources, but I do think that self-efficacy piece is important. That support piece is important. So those are things that they just have to be made aware of the resources and work with a life coach. There are plenty of services that are free, plenty of services that you can get through Medicaid, depending on your work, that you can get through your EAP program. But finding out what those resources are and bringing down every roadblock so that they do have true access to the services that they are guaranteed, because of the hardships that they didn't endure.
Absolutely. Well, guess what, guys? We are out of time for this segment. Diversity in the Foster Family, Part 2. And I want to thank my sagacious panel, Dr. David Bullock, Mr. Jeffrey Watson, and Mrs. Charmaine Guerriere, and mental health therapist Ashley Samuels. But I want to remind you to like and share this video. But before we leave, I'd like to leave this thought with you from an anonymous person or anonymous. There are no unwanted children, just unfound families. Again, this is your agent of change with this week's segment, Diversity in the Foster Family, Part 2. Signing off with Crack the Mic. Peace.
Me and old Hal have been together for a long time. Recently, I realized that I could use some help with basic, everyday tasks, but Hal depends on me, and I'm not going to leave him. I don't have to. Yes, that was good news, wasn't it, Hal?
Immaculate Home Health Care can give you the help you need so you can stay safely and comfortably at home from a few hours a day to round the clock. Call today for your consultation. 561-372-9108. 561-372-9108. Online at ImmaculateHHC.com.